So I thank the chair and I thank your willingness to work on a productive bipartisan agenda for this subcommittee. And I respect and I am grateful for your respecting my request that we have a hearing on mental health and the coronavirus. It was a topic that we were slated to talk about prior to the outbreak, but now that the outbreak has occurred, it has become even more serious. The human loss, the job loss, the isolation that Americans have faced due to this pandemic make it an even more critical topic. At the very beginning of this crisis, the American Psychiatric Association found that 1/3 of Americans felt it seriously affected their mental health. That reality, compounded with the existing prevalence of mental health and substance use disorders, make this issue urgent. According to the National Institute of Mental Health, nearly 1 in 5 adults lives with a mental illness. Ensuring proper supports are in place for families to manage and treat these illnesses should be a priority. So there are 22 bills before us today, and many of these bills have a bipartisan consensus. I appreciate that you have included the bills that I mentioned in my letter, specifically H.R. 3539, the Behavioral Interventions Guidelines Act, which I worked on with Dr. Drew Ferguson of Georgia. We had successful behavioral intervention programs in schools in our states, and that inspired us to work together. For me, it was hearing from the leadership at Texas Tech University Health Science Centers and their program to provide training for behavioral health intervention and telebehavioral health services at schools in rural West Texas. School-aged children are a prime age to identify and treat behavioral health issues before they worsen. I believe this bill is even more important now. Students have been away from school and friends during a difficult time, and some may be dealing with the loss of loved ones or being home with family, a difficult family situation. I hope that we will advance this bill toward markup. Other bills cover a wide range of important issues, from improving the National Suicide Prevention Hotline to extending the authorization for community services block grants. These bills will ensure stable, high-quality resources for those in need. One issue not addressed today is the mental health of the frontline healthcare worker. And this is especially important now. And I believe this has long been a serious issue in our healthcare system, but has taken on added importance with the additional stress that caring for the seriously ill coronavirus patient entails. I do have concerns about the Medicare bills. I do oppose opening Medicare's definition of what is a physician. I do support telemedicine. It's been critical during the coronavirus for many services, but we must make sure that appropriate guardrails are in place because we don't want it to be used inappropriately, as been noted by MedPAC and the Government Accountability Office and the Inspector General. We must also seriously evaluate if resources are better focused on getting psychologists and psychiatrists into underserved areas. I unfortunately need to devote some time to process. There is a strong bipartisan commitment to improve our nation's mental health, so I'm frustrated by the majority's willingness to make even small changes to some of the bills to accommodate some concerns prior to this hearing. And when compromise was clearly possible, we didn't. Majority staff acknowledged that changes would make some of these bills easier to enact. Still, what were introduced were very partisan bills instead of what we'd been working on to secure Republican support. Unfortunately, this has become all too predictable in the public health space in this Congress, which is sad because historically it is the public health space where this subcommittee comes together to legislate the most. It also concerns me that we are considering bills as introduced rather than the language negotiated as part of the bipartisan efforts. And this is not the first time that the majority and minority have had an agreement only to have the majority move the goalposts. It makes it difficult for members on this side of the dais to trust you and the agreements that are made. Ignoring our requests, our reasonable requests, actively harms the legacy of this committee. And it did not need to happen. I'm puzzled why it did. You should fully expect members to file amendments should bills be brought up to markup that you were unwilling to engage with us or our staff and then refused to acknowledge our proactive outreach and ignored our flagged concerns. My expectation for a supposedly non-controversial markup is that you will not notice these bills, but the ones where the general agreement had occurred. Many issues, but especially mental health, should rise above partisan politics. We should come together to change the landscape and provide the much needed resources to individuals who are struggling with mental health issues. And I'll yield back.